Hi, I'm Tamara Taggart, and I am at the BC Cancer Research Centre, and we are in Dr. Christian Steidl's lab, and we're talking to Dr. Steidl today about blood cancers. So maybe you can explain, what are blood cancers?
So blood cancers are actually an umbrella term for multiple forms of cancers. Usually we distinguish leukemias from lymphomas because they are affecting different parts of our organs and the blood system.
And then there's all different types of leukemias and lymphomas, right?
It's very important to emphasize that there is multiple forms of each. So it's not blood cancer, it's definitely blood cancers because they develop differently. Patients with these diseases respond differently to treatments, and also the prognoses are very different. So that's so important for us to find out how these cancers develop differently, and so that we can treat patients adequately with the best treatments for each type that we know.
So when you started almost 20 years ago to today, has it changed? Has the research changed with that cancer?
Very much so, and that is very important for us to realize that research is an activity that is it's important to support research in a timely fashion. So we are running against the clock because treatments that were not available 20 years ago are available now. So there is targeted treatments now available that cure patients today, and the same patients with the same disease 20 years ago would not be cured and have died because time was running out, so to speak. Now, through research, we can cure so many more cancers, and that gives us hope that in the future we can cure more patients, and that we keep going hard at the problem to cure more patients through research.
You know, it's funny because sometimes it's hard to help people understand that research is important, because we want to cure, we want to fix it, we want it to go away. And when you give money for research, you give it and it sort of disappears. It seems like there's so much money given to research, but you're saying that in the past 20 years you've seen an incredible difference in the saving of lives with that research.
Yes, I think it's accurate to say that because of generous donations and the government funding research, we have achieved so much already. But we have to keep going, because even though the outcomes have improved, there's still so many people who die from all cancer types, specifically in leukemia and lymphoma. And we are on the right track, but we need the continuing support from foundations and from the government.
And this is my last question, do you think there's a connection between what you do in your research and other cancers? Are they all sort of connected in some way?
Well, first, we work together as a research community, and research groups focused on blood cancer communicate with research groups in breast cancer, in lung cancer, just to name a few. And we work on fairly similar problems. Some of the underlying biology that makes cancer are shared between these cancers, common causes, common approaches to treat, and we can learn from the different fields, and that is very encouraging, that it's teamwork for us.
Excellent. Thank you so much.
Thank you.
Well, a big thank you to Dr. Christian Steidl for speaking to us. I will be back with another segment.